Welcome to the ER Break Room, the University of Florida Department of Emergency Medicine's podcast. In here, we get to know each other, celebrate our achievements, and highlight our initiatives. I'm your host, Michael Petrauskas. Welcome back, everyone. It's a new year. Where did the fall semester go? Since we last talked, our department hosted a super fun tailgate for the faculty and staff. We put on Procedure Palooza for the medical students, and the department had its holiday party at Touchdown Terrace in Ben Hill Griffin Stadium. Also, residents matched into fellowships, which we will get into today. In upcoming events, faculty have an intriguing seminar in February put on by a former hostage and crisis negotiator for the Scotland Yard regarding communication and diffusing conflict. So don't miss out. Let's hit the other highs of the month now. Welcome back to Allison Gozman. She has started as the Department of Emergency Medicine's Assistant Director of Healthcare Administration, a well-deserved role. We are going to have to start calling our department the Vortex. People try to leave, but they get pulled back in. I think it is because we are so much fun. Jenna Glendinning accepted a new role as Assistant Director of HR Strategy in the College of Medicine Human Resources Office. Congratulations, Jenna. Luckily for us, she still has a foot in the Department of Emergency Medicine and will be seen around the office. And then finally, this begins the send-off semester for our fearless leader, Chair Mary Patterson. She has ushered us through so much change and progress of the past several years, something for which we are also thankful. She was actually the impetus for this podcast as well. Soon she will receive the semi-retirement that she truly deserves. Now, on to the guests. First up today on the ER Break Room, we have Dr. Ashley Dawson, one of our chief residents. Hello. Welcome to the podcast.
Hi.
Hi. It's always fun to bring on a chief or two throughout the year. And also, it's particularly at this time of year when we've just gone through the fellowship match in the last, month or so. And also you having matched as well, which we'll get to. But welcome.
Thank you. I'm excited.
And also, congratulations. Your chief year is almost over. And I know you put, I know it's probably, it's a bittersweet thing, right? Because it's a lot of work, right?
It's a lot of work, but it's rewarding in its own way. I feel like you grow a lot your chief year. It's like a little internship.
Yeah, there you go.
Exactly.
Nice. A little bit of extra something. Well, cool. Let's start, a brief overview of who you are. So where are you from? And tell me about growing up and where you went to school.
I am from a really small town in Kentucky. It's called Murray. The only thing that it is known for is John Morant went there for basketball when he was in college. Yeah.
That's a big name.
I know. From a really small school.
Wow.
So that's the only reason anyone knows what Murray is.
Okay.
I went there for college, and then I went to the University of Kentucky for medical school.
Oh, okay. So there's a college there as well in your hometown area?
Murray State.
Murray State. Oh, okay. Yeah, I've heard of Murray State. Yeah. So John Morant
because
went
of
to
John
Murray.
Morant.
Because of John Morant. Wow.
Yeah.
Now, is that Kentucky? That is horse country, right?
It is. It's beautiful. I kind of got offended when I first moved down here and people say that Ocala is horse country. And I'm like, no, it's not. You've not been to horse country.
Oh, wow. Well, compare. I've driven through, I've been to Kentucky once in Lexington. It was unreal. But then you go and drive through Ocala in those areas too. So how do they compare?
I mean, horse farms are pretty comparable. Ocala has a lot of horse farms. And from my understanding, I think a lot of Kentucky's racehorses are actually born in Ocala and then moved up to Kentucky for racing and horse farms and all that good stuff. But the horse farms in Kentucky are just beautiful. You have the rolling hills and the bluegrass. And you said Lexington, when you fly in and out of that airport, you're just in the middle of horses everywhere. It's beautiful.
I agree with that. It is beautiful. I was blown away. I was very struck. Do you ride and do you have horses?
No, I never rode horses growing up. I never had horses. But in Lexington, where I went to med school, they have the most beautiful horse track there. So every weekend we'd go to the horse races, and it was just a nice little relief in med school. Very fun. And it's very different down here. I went to the horse races in Tampa with my family, and in Kentucky, everyone gets all dressed up. You wear your Sunday best, you wear a hat. I walk into Tampa, I'm all dressed up, and everyone's wearing like blue jeans and a t-shirt. And I was like, oh God, I'm in the wrong place.
That's great. You probably got maybe some unwanted attention that
Yeah,
day.
probably.
Well, that's cool. That's a good story. I like
Uh,
that. All right. So residency, here we are. You're at, you're 2.5 years, almost 6 months to go or so. And tell me your favorite experience or memory, from residency.
like clinical
Could
experience or
be, I don't know,
just,
could be that, or it could be something social or camaraderie or trip or personal. I don't know. You take
yeah.
it any direction you want.
I think I, I think I'm really lucky. Our class is super close. The PGY3s is a class. We got here like 2 weeks before residency started our intern year. So those whole 2 weeks we just hung out together and we're very close because of it. So having two conferences behind us has been amazing. SAM, we had so much fun. We went to the conference, learned things, did things together, sim wars, that kind of stuff. But we went hiking and we went paddleboarding and did all this stuff we like to do together. And so that was super fun. And then, of course, Vegas is just, it's Vegas, but you get to do it with all your best friends. So um,
People looking
it was
out for
awesome.
you.
Yeah.
Yeah. Well, I was at as obviously I was at the SAM, and I did see that with your class. I was struck by I think your group and the camaraderie you have and the closeness, and you guys seem to have a lot of fun. So that's neat.
Yes.
Cool. All right. So then, all right. How about advice? If you could give advice to maybe incoming residents or the current interns, or even maybe a younger Dr. Dawson, what would you? I don't know, anything you would pass along?
I think intern year, people expect you to mess up. So just do it. Like mess up confidently, say your plan. And if you're wrong with that plan, who cares? Like you're going to learn from it. And intern year is such a fun time to push yourself because like you're so excited about medicine, you're so green, you're taking everything in. So pick up the volume, pick up the sickest patients in your pod or in your core and really learn from it because you know, next year when you're a second year, you're the one that everyone looks to and is like, "Hey, what should I do?" And you don't know that until you've done it a couple times. So I think intern year, like push yourself a lot so you're really comfortable the rest of residency.
That is excellent advice. And now that you said that, I just a recollection of my own came to me. You probably maybe you may or not remember this, but your intern year, and I was a new faculty then. It was probably the first 6 months of your intern year. There was a critical case and a code, and it was a patient that I was taking care of, but then was stable, then wasn't. And you just like jumped in and tried to intubate this patient and failed. And then I stepped in and tried to do the same. And I also failed. It was ended up being a critical airway. So, but
Oh no.
I was like, holy cow, that was she, do you remember this or no? Do you remember
No.
time? Okay.
No,
So
that's
it was,
crazy.
it was like, I don't know. It was like, wow, she was in her first couple months of residency. She jumped right into this very difficult situation and yeah, you failed. But then again, it wasn't like but it was a tough airway. I mean, it was crazy. There was multiple compounding factors, but, anyway, yeah. So that was great. So just, no
But
one
you
expects you
learn
to,
from that
yeah,
because
absolutely.
the other
Yes.
day I was supervising a really difficult airway and I was
Uh-huh.
able to say, here, try this, or hey,
Mm-hmm.
let's do this instead. So you just learn from it and it
Yeah.
is what it is.
Yeah, and that's great advice that, people don't expect you to be masters yet of everything you're going to do. So just go in there and try your best and there'll be backup. So awesome. That's
Yeah.
really good. Okay. How about the new chiefs? Any advice for our next round of chiefs that haven't picked or auditioned or anything else yet, but
No, chief year is hard.
yeah.
It's you have all your friends that you've grown to love, and now you're kind of in an awkward spot where they look at you a little different when you become chief because you have a new role and they respect the role of chief. And so stepping into that's always difficult. And I think the biggest thing I've learned is to pause this year and not reply to those emails immediately and not text back immediately and kind of get your emotions under control so that you can see things from everyone's perspective. Um, because I don't think anyone in residency is doing anything maliciously. I think everyone has their own stuff going on. And so pausing and trying to see everyone's perspective is super important and something that I've really had to learn this year.
Nice.
And not to take things personally. When people are mad, they're mad at the system. They're not mad at you.
Yeah.
So don't take it personally.
I still work on that every single day. My spouse tells me that. Don't take it personally.
Yeah.
But yes, that's great. That's great advice. I love that. Thank you for sharing this. Okay, on to On to the big reveal here. Some people know, but maybe not everyone. I don't know give me the full breakdown of your class and where people match for fellowship, because I'm always so impressed by how many people do fellowship from our program. Obviously, we offer a lot of fellowships here, and maybe you could even talk before you give the reveal about how that influences people in deciding to do a fellowship, and how maybe personally how it influenced you.
Yeah, we have so many fellowships here. I think we have 7 maybe. We have EMS, we have sports, ultrasound, critical care, admin. I think you can pursue an educational fellowship. I'm pediatrics.
Pediatrics. Is simulation part of the education, or is that separate? Or can we do that through us or no?
I'm not sure. We haven't had anyone since I've been here pursue sim, so I'm not sure.
Yeah, I'm not sure.
We have so many fellowships.
Yeah,
that
global health. Did you mention global health?
Oh, global health.
Global health. Yeah.
So we have a lot.
Okay. Yes.
But I think all of that gives you opportunity in residency, because there's like fellowship directors and there's people involved in all these fellowships. So like their passion bleeds into your residency training, and you're learning and you're exposed to all these fellowships all 3 years, even if you don't pursue a fellowship in that. So it's cool to see everyone's kind of niches play out and see where they go.
Cool. That's well said. Very cool. I hope the next year's the people who are applying right now for they can listen to this podcast, and then they can, hear you said this way better than I did in our interviews that I had with the applicants. But anyways, okay, on to the matches. Tell me who's going where.
Roger Brown is staying at UF for ultrasound fellowship.
Nice.
Amy Gwynn is going to the University of Illinois in Chicago for pain medicine.
Interesting. Yeah. And there's a little bit of a streak here going on, I think now.
Yeah, we have a lot of pain.
Yeah. That's kind of a new thing that I've appreciated. I didn't really see that. That's cool. We'll have to ask Amy more about that. That's cool. Okay. Continue.
And then Eric Nordhughes, Jessica Tanias, and myself are staying here at UF for EMS fellowship.
Wow. Trifecta there, juggernauts. That says a lot about our EMS fellowship, I think, to have. Yeah. There's been a contingency that have wanted to stay and do our EMS fellowship. So, all right, who else?
That's it for fellowship.
That's it for fellowship. Okay, that's it. Mm-hmm.
And then we have several people that are actually going to stay as attendings at UF too. So
please.
A lot of our class is staying.
I think you should, and if they're okay with their announcing, you can announce
they've already announced it.
Okay.
Alex Schwartz and Joanne Bethencourt are probably both staying.
Amazing.
So
that's amazing to have. So that would be 1, 2, 3, 4, 5. Then because 5 of you then.
And then Roger's doing 6. So
6. No, you're right. 6. Yes. That's amazing. And your class is
14.
14. Okay. That is
almost
incredible.
Half.
Wow. We'll be seeing, and you're going to be making that transition to being a resident to supervising residents in a very short while.
Yeah.
Which is probably exciting and a little scary too.
But I think UF is interesting because like a lot of people do stay, or a lot of people go off and come back.
Yeah.
So a lot of my seniors are still here. So it's really cool.
When I first started here, one of the PAs said that this place is referred to as the vortex. People will leave and then just sucks you right back in.
Yeah.
So
Dr. Johnston left and came back. She just came back. And Dr. Smith left and just came back.
Yes.
So everyone comes back.
It's amazing. It says so. I guess I like to always ask people what makes UF special, this is probably like a testament to that UF is a pretty special place. And a lot of people from the podcast episodes have always said to people, and I think that's a big component of it. But is there anything else that you think draws people back to UF, to our department specifically, to Gainesville, or what do you think? What do you think the secret sauce is?
People are always going to say it's the people because our department's really close, but we do cool stuff at UF too. Like I think sometimes EM can be monotonous if you go out somewhere and you don't love your job, but you never know what you're going to get day to day at UF. And I love that. Just crazy cases, crazy interactions with our patients. So it's very interesting day to day. And I think people want to enjoy their job. And so they come back because they enjoy UF.
That's well said. I certainly enjoy mine. So, well, thank you, Ashley, for coming on, and I look forward to working alongside you as a fellow. I guess would be faculty and fellow next year.
Yeah, I'm excited.
Our featured guest today on the ER Break Room is Taylor Smith, who is one of our nurse leaders in the adult emergency department here at UF Health. Um, there's much more to that, but Taylor, welcome.
Hi, thank you for having me.
Well, I'm so happy you agreed to join us here at the end of the year and start of the next. And also, I think you're the first nurse that I've talked to on the ER break room, which I'm super excited about because we have a lot to dig into here.
Yeah, I feel privileged. Thank you.
Well, okay, so let's start with the basics here. Where are you from? What was childhood like?
Okay. That's a long story, so I'll give you the short of
Ah,
it.
okay.
I am from South Georgia. I grew up in a few different homes, but I learned something from each home that I grew up in.
Mm-hmm.
So I went to nursing school in South Georgia. Actually, I finished high school when I was 17 and I went straight into nursing. I graduated the month before I turned 19, nursing school. So,
Wow. Wait a minute. So you graduated high school at 17 and you finished nursing school at 19?
yes.
Oh gosh, wow. And so when we get all these transfer calls from like South Georgia, you know exactly where they're coming from then, I guess.
Yeah,
Because I'm always like,
it's funny because some of them
yeah.
people would be like, "Oh, I can't believe they did this there," and I'm like, "I can, I worked there."
Oh, you did. So did you do some of your schooling in South Georgia too? Like what medical centers or schools?
Yeah, so I went to Abraham Baldwin, which is like an extension of UGA.
Mm-hmm.
That's where I got my first nursing degree, so I got an associate's then, and then
Mm-hmm.
I worked at Tift Regional, which is now Southwell. That
Okay.
is where I began my career, and then I worked
Mm-hmm.
PRN at a few other facilities in the area. So it's
Mm-hmm.
really funny to get those transfers because I'm like, oh, I worked there.
Oh my gosh, yeah, that's great. What? Oh,
Yeah.
so then questions you mentioned. So what's the typical? I know there can be different paths to becoming a nurse, and then as you get into more and more leadership positions, you do more things. Tell me about like the pathway for other people who might be aspiring or just want to understand the education that you got and how you got here.
Yeah, so an associate's in nursing is once you're in the program, 2 years. There's 2 years of prereqs to get into the program. So 4 years total, but you still only get an associate's degree in the end. And that really focuses on like your hands-on how to be a nurse. And then
Mm-hmm.
after that, and to work at a magnet facility, so UF is a magnet facility, you have to have a bachelor's in nursing. So then you would go back to obtain that. And that's more of your like theoretical nursing.
Mm-hmm.
So, and then after that, there are so many pathways, right? Like you can go to CRNA school, you can become a nurse practitioner, you can specialize in any field that you want to.
Mm-hmm.
Yeah,
And I noticed too that like a lot of nurses end up in hospital leadership.
yeah,
Oftentimes,
there's the
and
executive route.
yes, the C-suite, right? Maybe your future. Maybe your
Wait,
future.
we're gonna get in trouble for calling it that.
Oh,
The
wait, is that we're
C-suite.
not allowed to do that anymore? Oh gosh.
I do.
Oh no. Okay, so then, all right, so you become a nurse. You've worked at different places, different environments. What? Okay, tell me about like the ins and outs of like a clinical shift as a nurse. What are some of your priorities, or just yeah? Tell me how do you like prioritize your tasks and decide what you need to be doing and things like that.
Yeah, so this is actually something I share with like all of my colleagues is when I started my career, I started at a very small rural hospital.
Hmm.
And the resources were slim to none. So you had to learn how to do everything yourself, your vent management, helping with
Wow.
your intubations, all of your med draws. You didn't have
Mm.
pharmacy, you didn't have any of that. So I feel like I actually have like the upper hand sometimes because I spent time learning how to do those things. And then you come here and you have the resources, right? Because we have like the highest acuity in the nation.
Hmm.
And so
Hmm.
we fortunately have all these resources that can be spared to help us in the ED, but I feel like having the knowledge behind what you're doing is vital, right? Like
Wow.
there's nothing you can beat having that
Yeah.
knowledge.
Yeah.
Um, so as far as a clinical shift for me, so my role, I am the clinical coordinator here in the adult ED.
Yes. Oh, and I was going to get to that. I was not shortchanging you. I just was building. But yes, tell me. Okay, because
Yeah, yeah.
I want to know about the hierarchy too. Like that was,
Oh,
part of
okay.
it
So
is
let me tell you
someone.
about a staff nurse.
Please, yeah, no, but also I want to know about the hierarchy and how it all works in our ER because people come from different hospital systems and maybe new students or residents who are listening want to know how this all kind of fits into the structure. So yeah, go for it.
Yes, let's do it.
Yes.
Okay.
Yeah.
So, a staff nurse. So that
Mm-hmm.
is your nurse who comes in and works at the bedside. to be a staff nurse here, ideally they would have 1 year of experience. Due to the nursing shortage, we've hired a lot of new grads, but we do have a nurse residency program that they're going through, which is like 5 to 8 months of hands-on learning with an experienced nurse. We're
Mhm.
very fortunate that we have that. So what that looks like is the start of your shift, you get your patient assignments. The coordinator, which is my role, assigns those patients based on ideally where you've been previously, your knowledge base, and your experience.
Mhm.
So once you have your patient experience or your patient assignment, that is where you stay for the remainder of your shift. So you're going to spend those next 12 hours, seems like forever, learning those patients and managing those patients. And as you're well aware, our patients stay in our ED for quite a while.
Yeah, yeah, it
Which
can happen.
with that, you get to
Yeah.
really learn your patient and help manage. Um, we're looking at the upsides.
Yes, that's right. That's right. Yeah. Uh-huh.
Yeah, so those 12 hours are
Mhm.
just going to spend at the bedside managing that patient.
Mhm. Yeah.
And then, so we'll go through the hierarchy if you're okay with that.
Yeah, please. I want to. Yes.
All
Mhm.
right, perfect.
Well,
Okay.
actually, I will learn stuff too because I spend, as you probably know, I spend more of my time at the freestandings and the peds than the adults, so it will help me understand things too. So,
I
yeah.
actually I feel like it is a knowledge deficit for everyone except for maybe the like five of us that know what's happening.
So
So yeah,
please,
let's do it.
yes, let's do it.
So from a staff nurse, you can become trauma trained. Once you become,
Hmm.
you have to be in the department for a year, and
Okay.
you have to have TNCC, which is certification saying that you are able to handle your trauma patients. It is a 2 day course. It's similar to ACLS, just trauma based. And
Hmm.
then after that, you can become trauma trained. That takes a couple of shifts. You work alongside an experienced trauma nurse. Once you've done that for about a year, you can become a charge nurse in the department.
Oh.
So the easiest way to explain a charge nurse, I feel like, because our charge nurses do not align with other charge nurses at other hospitals. To be a charge nurse, the best way to describe that is like you're working like the command center of an airport, and all the planes are coming in, and you're like, okay, you land here, you go here. Our charge nurse focuses on our incoming patients and where those
Hmm.
patients are going to go within our department.
Hmm.
So after charge, then you move into the leadership realm. So clinical coordinator, that's my role.
And that's the
And
charge. That's like a clinical coordinator is the charge nurse or no?
I feel like that the
Oh,
clinical coordinator, so no, the charge
no.
nurse is its
Okay.
own role. So there's a
Okay. It's on
charge
roll.
nurse on the floor.
Okay. Okay.
Um, I feel like when comparing to other facilities and other departments, though, the clinical coordinator and the charge nurse are usually one. The only difference is we see
Oh,
so many patients
right.
and they're
Right.
so sick that it's not possible in our department.
Oh, so like when I'm at the freestanding, we have probably one person does both of those
Yeah,
roles.
yeah, they
Okay.
do.
All right. So, okay. So good.
That's
So you
your
just,
coordinator at the freestanding.
okay. So your charge nurse is the kind of like the traffic controller you said, right?
Yeah,
Where do people
yeah.
land? All that stuff. Okay. So then you get to clinical coordinator, which is what you do. Okay. Go ahead.
A clinical coordinator. So I focus on the outgoings of the department, and the management within the department. So I focus on my patients who have been admitted, our boarders that sit in the department, making sure that they're still getting addressed and seen by the inpatient teams, and then our management of our patients within the department. So those
Mhm.
really high acuity patients, our traumas, our strokes, our STEMIs. It is my responsibility to be able to function in any role within the department and assist my staff nurses in any way possible.
Wow.
Yeah,
That's
so I
crazy.
am an on the floor resource.
Yes. Wow. Yeah. And also all
Yeah.
these like dispositions and then, these crazy sick people. Yeah.
Yeah, the
Wow. 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 Wow.
dispositions, I feel like I
Hmm.
spend the most time. I joke, I say I only see the really sick patients in the department. I don't ever get to see the medium sick patients. And then I stare at a computer for the rest of my shift. Those are the
Oh
two
no!
things that I do.
Oh no! Well, we're glad you do it. I mean, because you help find these patients beds in different parts of the hospital, and probably coordinate with different charge nurses on the floors and stuff to
Yeah,
get people
it's actually
placed.
it's an
Yeah.
interesting role. I feel like the easiest way to describe it is really I feel like in the coordinator role we're a liaison between the physicians and the nurses.
Hmm.
So I spend most of my time communicating with the different consulting teams, the physicians within the department, and
Oh.
then you're not aware because you don't spend much time with us, but we
Yeah.
round with all of the PICs, all of the core providers. And then
Uh-huh.
with our residents, I feel like as a coordinator, I have this incredibly unique opportunity where I get to watch our residents come through as like little babies, little interns. And I get to
Yeah.
actually watch them grow because I'm not staffing. And so I get to watch how their management changes and their differentials and like the growth that they have in their knowledge base, which is a pretty cool opportunity.
That is, yeah, that's amazing. And I guess that they must like you came recommended from our our chief resident, so to interview. So yes, they must appreciate your role and their education too. So that's pretty neat. Well, that's so it sounds like you enjoy the academic nature of our institution.
Yeah, I
Yeah.
mean, I think there's something to be said, right? Like we have
Yeah.
the highest acuity
Yeah.
in the nation, and we're
Hmm.
still teaching while we do that.
It's amazing. It's crazy. That's why I love what I do too, and that's yeah, it's pretty neat. Is there anything that on the flip side, not to be, we're not trying to be negative, but are there any frustrations? And the reason why I asked this is because I want to see if you can give maybe any guidance or advice for the residents or students and attendings. So yeah, is there any frustrations that might be related to what we can do? One thing I
I
learned,
feel
yeah,
like,
go ahead. I'll let you talk.
go
Go
ahead. No,
ahead. No,
you.
no, no. Like I learned early in my residency not to like, trickle in your orders, over time. And that's one thing that nurses always hate, right? I got to go do another blood draw, so I try to, but then again, the nature of academics is sometimes like first the intern will see it, then that maybe another, and then you just add as attending wants different things. So go ahead. Tell me what your thoughts are. Maybe
Yeah,
not
it's
related to
funny that you
that.
said that. I feel like
Yeah.
everyone that's like hounded on them day one, don't trickle in your orders. Fortunately, that doesn't affect me a whole lot in
Yes.
my role, so I've
Right.
kind of moved past that. You can trickle
Yeah.
in your orders, it's
No,
fine.
that's fine.
Uh,
What other things? Are there any other like
yeah.
frustrations or things that we can do that because it sounds like you do a lot of communication. So I don't know. What are some
Yeah,
things?
I feel like um from a frustrating standpoint, our disposition times are pretty slow, right? But that falls into
Mm-hmm.
the same category that you just said.
Yeah.
Is oftentimes an intern goes and sees the patient and they come back and staff it with the resident, and then the resident's like, okay, we should talk to our attending. And there's just a lot of barriers that have to happen before you can actually dispose the patient. That's
Mm-hmm.
challenging because a large portion of my job is ensuring that our dispo times are adequate and efficient. And so
Yeah.
it's hard to rely on other people. It's something I've gotten better with, but it's hard to rely
Mm-hmm.
on other people to help you accomplish your job.
Wow. Yeah. So true. And also work. And I mean, there's that aspect, and then there's also things that are like out of our control, right? There's so many other working parts of the hospital that we can't. We're trying to affect change. I mean, you're part of these. It's funny because I knew about you before I met you because you were in similar meetings that we're talking about some of these challenges as an institution, and we're making progress on them. So
Yeah,
it's kind
we
of
are.
cool and exciting too. Like I enjoy that stuff. I'm not sure about you, but
Yeah, I do.
is
I have such a good time, especially like our group with Fahim. That is, I look forward to that every single
yes,
month. So.
yes, yes. The ED console crew. So okay, what about okay? So you mentioned too. You told me briefly that you did spend a little bit of time in the PZR,
Mhm.
but while you were also working the adult ER, and then you kind of just because of the nature of the demands of your current job, you don't do it anymore. Were there any things, any positives, or maybe how do you compare and contrast like working in a peds environment versus an adult environment?
Yeah, so the hospitals that I started in treated both adults and pediatric patients. And so when I moved here initially, one of my biggest concerns was I didn't want to lose those skills. I wanted to
Hmm.
make sure that I could stay up on my pediatric skills. So I cross-trained in the PDD while I was still a staff nurse. I feel like one of the biggest things you take away from treating pediatric patients is not even treating the pediatric patients, it's treating their parents
Yes,
while they're
yes.
there. And I honestly, I feel like that benefits us in the adult world. I really feel like everyone should go through the PDD because if nothing else, it ensures that you're able to effectively communicate with your patient, which just goes such a long way.
Yeah, that's for sure. That's for sure. One of the things I just, at the end of the day, like I pick up some Pete shifts every month, and just, you walk away just happy because you got to see all these cute little kids, and most of the time they're going to be okay, and most of the time, like you said, like interactions with the parents are so nice, and it is kind of for me, it's a heartwarming alternative to the adult side, which is also really cool and fun stuff. And I try to take some things that I learned in the ped side, like you said, like the communication and talking to people, and bring that joy over to the adult side. I don't know. I think there's like you said, everyone should just be required to do some shifts there every once in a while, just to get that little
Yeah,
essence, you know?
I
So
agree. And I
yeah.
also, something that I think about and I've mentioned a couple of times is where we work specifically, we get all the pediatric traumas in the adult trauma bay. So I
Ah,
feel like those are skills that you have to really hone in on. So when you do get this
hmm,
super sick patient, you can still perform to the standard
yeah.
that's expected.
Wow. No, that's really insightful. Cool.
Yeah.
Very cool. Okay. So now I overheard a conversation with you and one of the surgery residents, and you were talking about global. No, this isn't embarrassing. No, nothing embarrassing and crazy. But you were talking about global health work. Tell me. So
Yeah.
tell me about this other stuff that you do.
Okay. I'll tell you how this started.
Okay.
He might disagree with me, but
Okay.
Dr. Becker has been a friend of mine for a while.
Awesome.
And I knew what he was doing, and I feel like I just pestered him just enough that he was like, "Okay, you can come."
That's great.
So that was like 2 years ago
Yeah.
now.
Uh-huh.
It's been incredible.
Mhm.
It's made such a difference. I have learned and taken away so much. So I have been to Ghana. I'm actually going back in 2 weeks.
Wow.
Yeah, so done a few things there, but I feel like my biggest takeaway and like one of my most exciting things is I've established relationships with their nursing leadership at their facilities there in Ghana. And
Wow.
so even now, I mean, it's been 10 months since I've been there the last time, and we still communicate weekly about like what's
Wow.
going on in their facility, what they need, what kind of education they could benefit from. And then I learn from them. We'll talk on the phone and they'll be like, "This is what's been happening here." And I'm like, "Oh." It's also really funny to see like the contrast, right? Because they'll be like, "We have so many viral illnesses right now." And I'm like, "Us too." So that's been really
That's
fun.
great.
So when we go back, I'll spend
Yeah.
time at a few different facilities with my nursing colleagues there, which I'm really excited about. I have a few classes lined up at different facilities. I let them kind of take the lead on what we're going to talk about this time. Last time we did ultrasound line placement and then a couple of other lectures. And then I've
Hmm.
kind of let them take the lead on what we're going to talk about in these classes. And then at one facility in particular, last time I was there, we talked about a triage system for their accident and emergency because they have varying departments. So they have like a med surge emergency and they have an OB emergency and a pediatric emergency, and it's all separated. And so we talked about a like uniformed central triage system. And so we're going to work really hard on this next trip to make that come to fruition because it's been approved. We're going to figure out where we're going to do it. I'm really excited.
That's incredible. That's really
Yeah.
cool. Wow, that's so cool. Wow, and are you? So I know that Torben goes to, so he goes to Ghana and he goes to other places too. Are you going to go to some of his other sites as well at some point, or not? Or are you just going to focus on the
I'm going to
relationships you
pester
built?
him to take me to all of them.
That's great.
I
I
hope he
love that
watches this.
enthusiasm. He better. Well, he was, as you know, it's a previous guest, so I hopefully he does and it supports you by listening here. Well, now he'll know. The message will be out there, and other people who listen can also pester him for you.
And they should, because I mean, at
Yes.
this point, specifically my nursing classes have grown so much that I actually was talking the other day. I was like, I need more nurses to go with me.
Wow. Yes.
Yes.
I'm sure there are other nurses that are interested in and would be
Yeah,
willing. Yeah, very
I'm
cool.
working
Very
on it.
cool. That's awesome. That is so cool. Keep us posted on that. And if something, major developments happen there, I'll have to have you back on and talk about it some more. Very cool. All right. So then tell me about it. Now, I'll let you open or as much of this can as you want. What are your future aspirations? Because I did hear whisperings of potential of stuff. No, I forget
Um,
who told me, but I heard you asking questions about maybe go ahead, but you can say if you have any aspirations or not, if you want to
okay.
put them out there in the ether.
So I'm currently in a post-bac
Yeah.
program.
Yes.
I love to learn.
Mm-hmm.
So initially, because of my childhood, a whole can of worms here. Because of
Mm-hmm.
my childhood, I really needed to join a field where I could start caring for myself immediately, which is
Mm-hmm.
why I got my associates in nursing. My goal and my aspirations were always to go to medical school.
Wow.
So I'm finally in a place where
Yeah.
I am established in my career, and I was like, I'm gonna do it.
That's
So
amazing. Oh, that's incredible. That's what the whisperings I heard. So that's awesome. So cool. So cool. Well, I'm sure you're going to have a lot of advocates on your behalf and supporters and mentors and stuff. So that is cool.
thank you.
Very cool. Is it, what's the time frame for that potentially? Not to cut you out of our ER because we need you as a coordinator currently, but a
It's funny
couple
that you say
years.
that. Every single
Yeah.
person I tell that I want to go to
Yeah.
med school, they're like, "Are you going to stop being a nurse?"
Right. That's the
I'm
thing.
like,
It's like,
well,
no,
yes.
don't leave us. We need you. Right.
Um,
Yeah.
so I have another year,
Hmm.
probably like a year and a half in my post-bac
Hmm.
program. So
Cool.
I'll work through
Yeah.
that, and then
Nice.
I will take the MCAT after that.
Yeah, very cool. Oh, that's awesome. Well, I'm sure you'll have a steady stream of residents ready to like help you in the next step, getting in and med students and everything else. So that's exciting. That's cool. And it's also just aside, I think it's great that you're going to have this life experience. It's never too late to reinvent yourself. I started medical school at age 31 after being a high school teacher. So I
Oh
mean,
my
it's
gosh.
great to bring other experiences into your work. So that's awesome. Very cool. It can work out.
Thank
And
you.
then more personally, any hobbies that you pursue in your spare time? What do you like about Gainesville? Do you live in Gainesville?
Yeah, I do.
Yeah,
I live
yeah,
near Hill Plantation.
yeah,
Um, well, I don't have a whole lot of free time right now. I
yeah.
actually have two children. I'm a single
Oh,
mom. Yeah.
wow. Oh,
I have a
wow.
5-year-old and a
No
3-year-old. So
way.
I'm
I don't
kind
know.
of, yeah, I'm like putting all of this together in a pot, and
Oh my goodness. That is incredible. I just have one and that is wow. I don't know how you do it. Two kids and work and stuff. So holy smokes.
me neither.
Yeah, yeah. Support, right? We rely on people to help and support and daycare and
Yes, daycare,
school, right?
school.
That's
Yeah.
why I'm able to record right now is in daycare and school. That's incredible. Well, I hope the holidays were wonderful for your kids.
Yeah, they
Yeah,
were. Thank
that's
you.
so nice.
You as well.
Yes, they are. Yeah, some family, of older family member was asked who was older, children or adults now. What were your favorite memories from all the like it was Christmases and this family and they said, oh, just when my kids were young, just seeing them and the joy they had. So I
Yeah.
took that to heart, like having a young one myself. So very
Yeah.
cool. So no, yeah, hobbies are your kids, right? That's basically it.
Yeah. All of my free time is spent there. So,
That's right. And picking up shifts at the ER apparently.
yeah. Yeah.
Okay. A favorite restaurant? What about kid friendly restaurant or aside from kids?
Ooh.
Yeah.
Okay. I don't
Hmm.
have a favorite kid-friendly restaurant, but there's a food truck in
But
town.
yourself. What?
Yes. There's a food truck in town, and
Oh,
it's
tell me.
called M&D West African.
Oh, really?
It's
Yeah.
African cuisine. I
Yes.
recommend the fufu and the goosey.
Yes.
Yes, it's
That
delicious.
This is wonderful. This is a pearl because I haven't heard this before. This is wonderful. I'm going to look for this for sure. And
I
they go
feel like you
different.
should have it tonight.
Yeah. No, I'll be working tonight, so I won't be tonight. It'll maybe the weekend. The weekend though. It's NMD West African.
M and D
Oh,
West
M&D.
African.
Okay, M&D
Hmm.
West African. Awesome.
Hmm.
Okay, that's a good rec. That is a good rec I'm going to take. And then
Yes.
finally, tell me the last thing about this. Aside, we talked about the acuity and So what about what about UF emergency medicine? This department. I know everyone says the people. I mean, give me a take on the people? Something special about our department, our group.
You've probably heard this before, but I love the collaborative environment that we have, right? And I get to experience that more so, I feel like, than any other nurse in our department because I am that liaison, right? I get to work with our physicians so closely. I get to say, hey, why is this disposition taking so long? What is your plan here? What are we doing? And then I get to go do the same thing to the nurses.
That's perfect.
Um, and I just
Yes.
love that one of my other like favorite things that I tell everyone, I can like remember this very specific case. I'll actually give you two examples,
Hmm.
where we were resuscitating a patient and just nothing was working. And I like stepped back and the attending stepped back out of the room and he looked at me and he was like, what should we do next? And I was like,
Wow.
hmm. And in that moment, I was like, I love it here.
Yeah.
Because he was
Yeah.
so serious. He was like,
Yes.
what do you want to do next?
Yes. Yes.
And like we just have this incredible environment where we can work so.
Yep. I gotcha. You were just saying it's an incredibly
You can,
collaborative environment. I'm gonna be doing
yes.
more cutting.
I'm so sorry. Can you
It's
see me?
okay. No, but that's all right. But you're gonna tell me one. I think it's still uploading, so we'll keep going here. What you were gonna
Okay.
tell me one other story?
Yeah, so I love our ECPR program that we have right now. This is
Wow.
one of my other babies. I
Mm-hmm.
enjoy it so much, mainly because we're offering this service that so few other facilities are able to offer, right? So ECPR is
Mm-hmm.
ECMO cannulation in the setting of CPR.
Mm-hmm.
And so few other facilities are able to offer this. And previously, the chance of survival from an out of hospital cardiac arrest was less than 1%. And at this point, I think last time I saw our stats, we were at greater than like 50% chance of survival with cannulation. That's not
Wow.
small numbers.
No, that's insane.
We're
Yes.
changing lives
Yes.
and we're
Yes.
saving lives. Not only are we
Yes.
changing lives, we are
Yes.
quite literally
Yes.
bringing them back to life.
Mm-hmm.
Which is just like something I love to acknowledge. I feel like that's one of the most special parts of our department right now is that
It's
we're able
incredible.
to do that. Yeah, and that is
Yeah.
it plays along into the same thing. It's so collaborative. I can't tell you how
Mm-hmm.
many times I've called our ECPR team and I'm like, "Hey, we have this going on right now. Um, what do you think?" And they'll be like, "All
Yeah.
right, I'll be there in 10 minutes."
Yeah. That's
So,
incredible. Incredible.
yeah.
That's amazing. That is really cool. Well, Taylor, I thank you for coming on to the break room and sharing your story and your insights. And I hope that I certainly learned something from today. And I think that other learners and attendings will also enjoy this interview.
I hope so. Thank you so much for having me.
Absolutely. See you around the ER.
All right, bye.
That's all for this episode. Special thanks to our chair, Dr. Mary Patterson, for supporting this podcast, and to Dr. Giuliano Deportu for composing our theme music. I'm Michael Petrauskas. Be well.